Hello, and welcome to our special report. It starts with Mom Live, Wellness Warriors. I'm Jacqueline Howard, a health reporter at CNN, covering the latest news in medicine and healthy living. And I'm so glad to be with you today as we're connecting with a unique and heartfelt look at the importance of vaccines through the eyes of those who know best. Moms. And vaccines have long been a cornerstone of public health, protecting individuals and communities from a myriad of diseases. Yet, in today's climate, we know that questions and concerns about vaccinations are more prevalent than ever. That's why we've turned to March of Dimes and four incredible moms, each with their own personal or professional insights into the importance of vaccines. In this special report, we'll meet a pregnant mom who also happens to be a pediatrician, and she will share her journey and her considerations regarding vaccinations before, during, and after pregnancy. Her story, it really highlights the decisions many expectant mothers must make to protect their unborn children. And next, we'll hear from a teacher and parent whose dual perspective offers a realistic look into our classrooms, where ensuring children are vaccinated as they head back to school safeguards not just their health, but the health of their classmates and community. We'll also delve into the world of the NICU, the neonatal intensive care unit, and we'll hear from a mom who will give us an intimate look at the importance of vaccines and immunizations for the most vulnerable newborns, especially those who've spent time in neonatal intensive care. And finally, we'll connect directly with a dedicated healthcare professional, a physician, and a mom who's on the front lines caring for moms and babies. Her perspective will lay the groundwork for our whole discussion, underscoring the vital role vaccines and immunizations play in maternal and infant health. Through their stories, we aim to provide a comprehensive, empathetic, and informative perspective on vaccines, addressing common concerns and emphasizing the profound impact they have on our families and society. This special report is part of the March of Dimes, It Starts with Mom series. As we connect with other moms about what we need to know, we definitely know that every day March of Dimes fights for the health of all moms and babies. Moms need a community to lean on, people we can turn to who will listen and support us. We can't do it alone, and we shouldn't have to. March of Dimes is there for women at every stage of motherhood, even when things don't go according to plan. We're so glad you're here with us as we explore these powerful narratives and discover the true value of vaccines through the voices of mothers. After all, it starts with mom. Our first guest is someone who embodies the intersection of maternal dedication and professional expertise. Meet Dr. Amna Husain, a mother who's currently expecting her third child. In fact, there's a very good chance that between the time she recorded this and when you see it, she will have had that third baby, because baby number 3 is expected any minute now. But Amna, she's also a physician. She's a board-certified pediatrician, board-certified lactation consultant, private practice owner, and children's book author. She currently resides in North Carolina. And as a mother to young children, Dr. Husain is a strong believer that our children deserve the best care and that pediatricians are the cornerstone of helping parents and families raise the next generation. As a millennial parent herself, she also loves delivering meaningful pediatric and parenting education to her friends and followers on social media. And she's joining us today for exactly that. Pregnancy, it's a critical period that many expectant mothers navigate with great care. Vaccination during pregnancy brings up many questions and sometimes concerns, but it's also a time when protection is paramount. Amna's own journey through pregnancy has included lots of questions and considerations for her own health and the health of her unborn baby. So, with the keen awareness of the importance of vaccines, she'll share her personal experiences and the choices she's making to ensure a healthy start for her little one. Let's hear directly from her about her experience.
As baby's arrival is coming closer and closer, I'm doing all the things to prepare. It's not our first rodeo, so we're getting the infant car seat ready, prepping the crib, getting out newborn clothes, washing bottles. I'm also partnering with March of Dimes to showcase how I'm prepping to take care of my own health. As a pediatrician and mom, vaccination is a topic I'm very familiar with. You may all remember I was actually enrolled in a study on receiving the COVID vaccine while pregnant with Minnie. Vaccines during pregnancy safeguard pregnant people from potentially serious illnesses, such as the flu, RSV, and COVID-19. This protection extends to the developing baby. Complications from the flu during pregnancy can lead to preterm birth, low birth weight, and pregnancy loss. Vaccines help keep not only me, the mother, safe, but also the new baby on the way. Advocating for this important public health measure is just another important thing I can do to keep both of us healthy during this pregnancy.
Thank you, Amna, for sharing your heartfelt journey and the thoughtful steps you're taking to protect yourself and your baby through vaccination. Your story highlights the crucial decisions that many expectant mothers face to ensure the health and safety of their newborn children and unborn children. Thank you for opening up about your pregnancy, your decision making process regarding vaccinations, and the peace of mind that comes from knowing you're doing everything you can to protect your baby before they even take their first breath. Now, let's shift our focus to another critical aspect of our children's lives, and that's the school environment. Now, this is one place that not only brings children together every day, but it also connects families and entire communities. Ensuring that children are vaccinated before they return to school is essential, not only for their own health, but also for the well being of their classmates and the broader community. Our next guest is a current fourth grade teacher who is also a parent, Natalie Ringold. And as a dedicated teacher and mother, she sees every day the very clear and direct intersection between education and health and the negative effects that happen when kids miss school. They miss assignments and they miss learning because of health reasons. So, with her dual perspective as an educator and parent, Natalie will discuss what she's seen firsthand regarding the importance of vaccinations in keeping our children safe, in class, and thriving. She'll share her experiences and the proactive steps she takes to protect her students and her own children, highlighting the collective effort required to maintain a healthy learning environment. Hello there, Natalie, and thank you for welcoming us to your classroom.
Raise your hand if you're constantly trying not to get sick during the school year. Yeah, me too. As a fourth grade teacher, I am constantly trying to control the spread of germs in my classroom. I teach my students how to properly wash their hands, offer hand sanitizer throughout the entire day, and remind my kids to not share food items and to cover their coughs. But the reality is that there's only so much I can do. The number one way to protect yourself and your kids, including younger siblings or infants at home who might even be more susceptible, is to make sure they're all up to date on their recommended vaccines. That's why I'm partnering with March of Dimes to help raise awareness during back to school season. Plus, now there's a triple threat of respiratory diseases, the flu, COVID, and RSV, plus whooping cough's been going around like crazy. That's why I want to talk about vaccines now as we go back to school. Thankfully, I got my flu and COVID shot last fall, so I only got a mild case of COVID and did not get the flu. Nobody likes getting sick. And the reality is that teachers and parents want their kids to miss as few school days as possible to minimize makeup work, empty classes, getting other kids sick, and overall disrupted learning. The good news is that these diseases are preventable, and vaccines offer a safe way to build immunity without the associated risks that come with illnesses and complications. Our immune systems are exposed to countless germs every day. You can think of vaccines like tiny shields. They train your body to recognize and fight harmful viruses and bacteria, which ultimately lowers the risk of getting seriously sick. Just like my experience with COVID this past year. There is a lot of misinformation going around about vaccines. Be sure to talk to your healthcare provider. Carefully consider your sources and where you find information, and lean on your friends at March of Dimes for more information. Visit marchofdimes.org/vaccines for all of the latest updated tools and resources so that we can all start the school year strong and healthy and prepared.
Thank you, Natalie, or should I say Miss Ringold, for your heartfelt and insightful perspective on the importance of vaccinations, especially in the school environment. Your experience as both a teacher and a parent highlights in real everyday life how essential vaccines are in keeping our children healthy and our classrooms and our communities safe. Let's hear it for great teachers like Miss Ringold across the country. We are so grateful for you, and we wish you and all of your students a safe and successful school year. It's National Immunization Awareness Month, and this annual observance is designed to remind everyone that staying up to date on vaccinations is an important way to protect not only their health, but the health of everyone around them. Vaccines, they're a public health success story, and I'd like to turn back time a bit. In the spirit of Natalie and our beloved teachers everywhere, let's look back at some history. Did you know that the March of Dimes was created to find a cure for polio? It's true. What began in 1938 with President Franklin D. Roosevelt's personal struggle with polio led to the creation of the National Foundation for Infantile Paralysis, better known as March of Dimes. And from the very beginning, March of Dimes worked with scientists, volunteers, and everyday Americans to put a stop to the number one threat to children. What began with the fight against polio continued with the prevention of birth defects and has evolved to an organization dedicated to creating a world of healthy moms and strong babies. That brings us to today. As we continue our discussion on the importance of vaccines, it's essential to recognize the broader efforts and campaigns dedicated to supporting moms and babies. One of those campaigns is the March of Dimes It Starts With Mom campaign. It focuses on empowering mothers with the knowledge and resources they need to make informed health decisions, including the critical role vaccines play. Pregnancy, it can be a wild ride, but you're not alone. March of Dimes It Starts With Mom campaign is here to educate you with reliable, up-to-date information for you to take charge of your own pregnancy journey. It Starts With Mom is always available as the go-to resource packed with information you need from planning to pregnancy to postpartum. Be a part of a powerhouse community that understands and uplifts each other. For more information, visit itstartswithmom.org. As we continue our exploration of the profound impact of vaccines, we turn now to an environment where the stakes are incredibly high. That's the neonatal intensive care unit, or the NICU. Here, the importance of vaccination and immunization is magnified, as these tiniest and most vulnerable patients rely on every layer of protection we can provide. And our guest, she's Christina Bailey, a mom of four, teacher, photographer, and creator of the widely popular Instagram account at Baby Bailey Mama Drama. And there she shares her journey to motherhood via IVF and the experience she had with her own twins as they were born early at 33 weeks. And she spent time in the NICU. Christina's perspective as a mother who had such a long journey to become pregnant with her twins, and then she spent time in the NICU, her perspective provides a unique and powerful viewpoint on the necessity of vaccines and immunizations in safeguarding our most fragile infants. Her story is a testimony to the life-saving power of vaccines and the peace of mind they offer to families and healthcare providers alike. So, Christina, we welcome you here today.
As former NICU parents of children weighing 3 and 4 pounds, we want to support other NICU parents along with our partner, March of Dimes. Before we left the hospital, we were warned how an illness would have a drastic effect on the twins. It terrified us leaving the clean and sanitized NICU, worried about how could we prevent Graham and Eloise from getting sick. We all know germs are impossible to keep away entirely. We tried our best to sanitize our home and get their vaccines at the recommended age by doctors. Every child should get their vaccines in order to protect them as well as to attend school. For NICU babies, vaccines can be life-saving. The twins got their Hep B, DTaP, Hib, IPV, and so forth as they grew older with age. Although the twins have gotten sick numerous times, it has not been with anything we could have prevented. All kids get sick, but for NICU parents, our kids are hit even harder with common illnesses. Eloise was already hospitalized for 5 days for something most kids just recover from at home. I didn't have any hesitations or concerns about vaccinations, which is normal and fine. You're not wrong or weird if you don't have hesitations, but I understand if people do. My advice to other NICU parents who might be hesitant about vaccinating their medically sensitive baby is to talk to your healthcare provider about your concerns. Also, stay on top of your healthcare appointments. Make sure everyone washes their hands before touching your little one, ask family members who feel ill to avoid visiting, and know that you are doing the best you can. Together, as parents and with March of Dimes, we can all fight for the best health for our babies.
Thank you, Christina, for sharing why vaccines are a critical component in the fight to protect premature and medically fragile babies. Your story, it really highlights the life-saving role vaccines play in protecting our most vulnerable infants and provides a powerful reminder of the importance of immunization in the earliest stages of life. Now, as we move forward, our final guest is someone who embodies the intersection of professional expertise and maternal dedication. Dr. Darria Long is a Harvard and Yale-trained emergency physician, national best-selling author of Mom Hacks, and regular on national TV, including CNN, NBC, and Netflix. Dr. Darria helps parents prevent emergencies and know what to do when they happen. She is also an assistant professor at the University of Tennessee School of Medicine. But first and foremost, she's a mom. And as a mother herself, she brings a deeply personal perspective to the importance of vaccines. She's seen firsthand the critical role that vaccines play in safeguarding the health of babies and young children. And her insights are not just informed by her professional experience, but by her own journey as a mom who's navigated the complexities and concerns of vaccination for her children. Welcome, Dr. Darria.
Dr. Darria here, and I'm partnering with March of Dimes for National Immunization Month to talk about the benefits of vaccines and immunization. As an ER doctor and mom of 3, I've heard a lot of myths about vaccines that can worry moms and moms-to-be. With so much information and misinformation, learning the facts before making health decisions is important. The fact is, vaccines save lives. I saw for myself how with introduction of the Hib vaccine, H. influenza meningitis fell by 99%. In children under 5. 99%! That's huge! This is just one example of how vaccines can positively impact infant and child health. Diseases like polio, measles, pertussis were brought to an all-time low thanks to vaccines. But now we're seeing outbreaks of some of these preventable diseases in communities across the country due to people not getting vaccinated. Here are 4 facts to consider. 1. Vaccines are especially important for pregnant moms and babies. Staying up to date on vaccines during pregnancy helps mom pass along immunity to their baby until they can build their own. 2. Getting vaccines is safe for breastfeeding parents. 3. Vaccines and immunizations are safe for babies born preterm or at low birth weight. And 4. Vaccines help protect your baby from 14 serious diseases before their 2nd birthday. I encourage parents everywhere to first talk to your trusted healthcare providers about vaccines for you and your children, and second, help spread the facts about vaccines. Let's work together with March of Dimes to build a healthier community, one vaccination and immunization at a time.
Thank you, Dr. Darria, for that insightful and heartfelt perspective. It's clear that the role of vaccines in protecting both mothers and their newborns cannot be overstated. From the earliest days of life, vaccines provide a shield, safeguarding our most vulnerable. And as we wrap up our special report, we've journeyed through a series of compelling stories from 4 dedicated moms, each with a unique yet interconnected perspective on the importance of vaccines. From the early days of life in the NICU to the bustling classrooms where our children learn and grow, the message is clear. Vaccines are a critical tool in safeguarding the health and well-being of our families and communities. Through Dr. Amna Husain's careful considerations during pregnancy, Natalie Ringold's dedication as a teacher and mother, Christina Bailey's experience in the NICU, and Dr. Darria Long's expertise as a healthcare professional, we've seen the profound impact that vaccines have on every stage of life. These stories, they collectively highlight not just the personal significance of vaccines, but their broader societal importance as well. Vaccines are more than just a medical intervention. They are a testament to our collective responsibility to protect one another. And they protect the health of both mothers and their babies from pregnancy through those critical early months of life. As we've heard from these incredible moms, making informed decisions about vaccination starts with education, empathy, conversation, and a commitment to the health of our loved ones. As we conclude this special report, remember that every choice we make contributes to a healthier future as well. We hope these stories have really inspired you to embrace the power of vaccines in your own life and in the lives of those you care about. We encourage you to learn more. All you have to do is visit marchofdimes.org/vaccines. There you'll find immunization charts, recommendations, stories from other moms, and the latest up-to-date information you'll need. Thank you to March of Dimes and It Starts With Mom for this important program and conversation. Moms are the heart and soul of our world, and every mom and mom-to-be deserves the best, especially when it comes to their health and well-being. It Starts With Mom is an excellent resource for moms and mothers-to-be and their families to help them along the way through pregnancy and beyond. There's so much we feel like we need to know, and it's impossible to know everything. But we do know that to have healthy babies and families and communities, it starts with mom. So thank you. Thank you for joining us in this important conversation. Always remember, it starts with knowledge, it starts with community, it starts with care, and as always, it starts with mom. Thank you to It Starts With Mom partners HCA Healthcare with Clear Blue, Goldbug, Honest, Philips Advent, and Sanofi.